Yeah, Prescriptive Health at its core is a healthcare consumer technology company. So what we are trying to do is change the way that the prescription drug experience, prescription management experience for consumers. So for us, patients, everybody. Today, there's something called an electronic prescription, and you usually tell the doctor or a nurse or a PA, they ask you the question, like, where do you want your prescription sent? And usually you would say like CVS or Costco or Walgreens or somewhere. And after the doctor authors a prescription, you go to the pharmacy and you discover price, you discover whether there's a prior authorization required, maybe there's a delay, your insurance company may need to get some questions answered by the doctor. There's all this activity that happens after you've already left the doctor's office, and it can be prohibitively expensive. Something like 30 to 40% of Americans have said at one point in their life they've abandoned at the pharmacy because it's too expensive. So it's definitely a barrier for medication therapy. And so what we're planning to do is change this. We call it a digital prescription. What happens is the prescription lands on your phone in the doctor's office seconds after the doctor authors the prescription. We do a geolocation of all pharmacies around you, and we show you the price at all of them with your benefits. So we show all the costs of the prescription, and we show your benefit price. We show price with cash. We have the opportunity to pull in things like pharma assistance. If there's the manufacturer is willing to give you a coupon, we can show that right at the point of care. And also if there's going to be a delay on your medication, like what to expect when you get to the pharmacy. Maybe there is a prior authorization. So you can have a value-based conversation with your doctor. Doctor, I know I just got prescribed or just got diagnosed with diabetes. This medication is $200 a month. This is going to be a major problem. And by the way, this app shows me that there's another medication that is on a better place on the formulary for my plan, and it's only $50. Why don't we switch it to that one? Then you can have a conversation, and then that way it's more likely you're going to take medication. I mean, if you think about the cost to the American taxpayer and to us broadly in the United States on not taking medication, it's somewhere around $300 billion of additional medical spend because people aren't taking their medication. Well, part of the reason they aren't is this sort of problem that happens just getting access to medications, which we're trying to solve at Prescriptive. So there's this gap that exists between medical care and self-care. I would argue most people think when they go to pharmacy, it's part of their self-care because it doesn't feel extended as part of medical care. There's this gap that exists, right? What happens when those gaps exist? What are the real barriers that happen? Number one could be side effects of the medication, right? Let's say you have this terrible diagnosis of cancer and you're given an oncology drug, which is that you're taking, and then you have diarrhea. All of a sudden you have this bad diarrhea and you're like, you stop taking the medication. Like, because there's no connection. Like, it would be great if 4 days after you started taking the medication, I mean, we know that you're going to get diarrhea. Like, it's a common side effect. You get a text message and you're sitting on the toilet and you get the text message and you click a button and you can have a telemedicine visit. I need help with this diarrhea so I can stay on this medication. You see, so like, how do you, that's one example. Another one is like, your next, even something as simple as your next fill. Within like 23, 25 days after your first fill, if it's a 30-day fill, you can go get your next fill. Well, some pharmacies have their own systems where they will send you a reminder, it's time for your fill. Oftentimes they don't. You might miss that. Like, let's say it gets to day 32. Wouldn't it be great if a text message came, hey, we know you didn't fill your medication. Click here to fill it, right? Simple things like that. Or to get even more complicated, maybe the prior authorization that you got with your payer is good for a year. Well, what happens at the end of that year? You got to go through the whole process again. A lot of people fall off the wagon because the prior authorization doesn't get done. They have to like initiate it. They have to, the pharmacy has like, you get kind of lost in the whole mix of it all. And so you end up with this very disjointed, let's say it's a diabetic patient who should be taking their medications regularly. Any of these little areas where they may fall off are problematic. So how do you create, the problem is how do you create a seamless experience where medical care folds appropriately into self-care? And we at Prescriptive believe that that gateway is the prescription itself. Wrap an experience around the prescription and it follows you along, so you have ownership over the prescription and your health rather than it just landing in a pharmacist's lap. How do you sort of make the medical record work for you? That's kind of what we're trying to do. It's a pretty big, lofty goal. We've been plugging away now for 5 years on it. So